I said I'd remind you to start the recording. Okay, so
started it.
Thank you. So this webinar has been hosted by a special interest group which is part of the Q community. It's called Reimagining Health and Care, and it's convened by myself and Matt Bell, who works in Plymouth. You can find out more about us, and I am going to just I will add the link to the SIG group just here in the chat group. So if you want to find out more about us or join, you're very welcome to do that. It's absolutely free, and we welcome everybody from right across the spectrum. So please do join us there. So if you don't know Matthew Meze is the Community Relationship Manager for Q. He also co-founded Enlivening Edge, which publishes news from next stage organisations such as Buurtzorg, and he has a deep interest in this particular area himself. So thank you, Matthew, for all your help with this. Matthew's our tech advisor today, so if you're experiencing any sort of tech problems in terms of staying connected, if you want to directly message Matthew, he'll try and help you the best way that he can. He's also going to help me keep tabs on the chat box. So some of you might have posted some questions when you registered for Brendan, and we'll try and theme those so that we've got time to get as many in as possible at the end of Brendan's presentation. But if more questions arise while you're listening to Brendan, if you just want to post those again in the chat thread, we'll try and pick those up for you. As Matthew's already mentioned, if you can try and keep an eye on your microphone, sometimes they seem to unmute themselves, and because there's so many of us on this call, it can be a bit of a distraction. So if you can keep yourself on mute unless you're speaking, that'd be great. So I think that's everything. Have I missed anything, Matthew?
Other than maybe inviting people to introduce themselves in the chat box and say something about their interest in it.
Absolutely. Sorry. Yeah. So some of us have already started doing that. So if you want to check in the chat box, tell us a little bit about yourself, introduce, swap contact details. There's sometimes some great connections made in the chat thread. That'd be great. Okay.
It's worth.
So it gives me great pleasure.
Jane,
I missed that, Matthew. Say again.
I'm just going to say that the rest of the series, you could mention a couple of the ones that are coming up that people can register for and so on.
Yeah, okay. So, and I will post those details as well at the end, just before you leave. So next month we have Katie Rose talking about working with children's services and introducing a Buurtzorg inspired model, which very much supports relationships between staff and the children and families that they're working with. We then have Neil, who's on the call with us this morning, and he'll be presenting in March, and then Annie Francis will be presenting her webinar in April, and then I believe in May we've got Toby Lowe and Gary talking about different ways of funding and commissioning that can support this way of working as well. So we'll publish all of those details of all of those webinars on the Q website, but we'll also give you a few links later as we finish this webinar. Okay, so I'm really pleased to be able to introduce Brendan Martin. So if you don't know Brendan was inspired by his personal experiences to partner with Just a Block and bring the Buurtzorg approach to the UK, and that was back in 2015. So since that time, Buurtzorg has worked with a significant number of organisations in the NHS, in social care, and in the charity sector. And so not just ones providing nursing, but providing lots of different kinds of health and support and care. So we're really grateful to Brendan for offering his time and for sharing his experiences and his learning so far. And hopefully I think he's going to give us a little sneaky peek, a glimpse into the future vision for Buurtzorg in the UK, which I'm quite excited to hear about too. So Brendan, if we can hand over to you now, that'd be great. Thank you.
Thank you. All I got to do now is work out how to share this properly. Oh, that worked. I hope you can all see my slides. Firstly, thank you, Jane, very much indeed for inviting me, and also Matthew. It's a pleasure to be here and to take part, and indeed to kick off this very interesting series. I don't know why that flicked on. As Jane said, my background, the reason I come to be speaking about Buurtzorg is that I founded and run a small social enterprise called Public World, which supports organizations providing public services to change the way they work by developing better relationships with the people that they support, and particularly by supporting greater staff involvement, including self-managed teams in their own organizations. My experience of looking after my mum towards the end of her life introduced me to all of the positive and negative characteristics of home care in Britain, and left me with the experience, and the experience led me to want to apply what I had learned over many years of my professional life to trying to do something about home care in Britain, which is essentially what I've been doing ever since. And one of the things that we did was to seek out, well, we had, of course, had an idea about what kind of home care we wanted: relationship-based, person-centered care provided by neighbourhood teams that were self-managing. And my inspiration for that came from seeing the capability of the care workers and other professionals that were looking after my mum, but also the way in which they were obstructed in doing their best by organizations and systems that did not serve them well. So our idea was that we needed self-managed neighborhood teams, and we looked around internationally for inspiration for that, and we quickly found that Buurtzorg was doing everything we'd imagined and a whole lot more, and had made a great success of it. So we asked Buurtzorg to get involved in one of our projects, and Jos de Blok, the founder of Buurtzorg, was kind enough to agree, and we've been working together since then, and he asked us to be, as Jane mentioned, their partner. The other logo you see there, apart from Buurtzorg's and Public World's, is one I must mention. It's because some of our work is now being supported by an EU fund, through which we're setting up many teams working in partnership in Kent with Kent Community Health NHS Foundation Trust, Medway Community Health, and Kent County Council. This is part of a 3-country project, and which is growing the Buurtzorg way in health and social care at home quite rapidly in Kent and in France and Belgium too. What almost everybody who's heard of Buurtzorg has heard of it in connection with the way it operates through self-managed neighborhood teams. And of course, that is a fundamental characteristic. But actually, to really understand what Buurtzorg's about, you need to take a step further back. And indeed, think about what Buurtzorg, the Dutch for neighborhood care, actually means. What it means is starting again from the perspective of the person needing support, and developing with them, professionals, nurses and other care professionals, working with them to find ways to mobilize their strengths and to support them to achieve what they want to achieve, not only by mobilizing and developing and sometimes reigniting their own capacities, but also by mobilizing and developing the social supports around them, whether it be family, neighbors, or voluntary organizations. And in Buurtzorg, that's represented by the onion model that's on the screen now. And Buurtzorg professionals talk about this, for example, by saying first coffee, then care. What they mean is build first a relationship with the person you're going to support, to understand their context, their aspirations, their goals, and their capacities, and build on that. And by doing so, develop a care plan with them that meets their needs, and do what is needed when it is needed. And this kind of care has resulted in very much improved levels of support and quality of care in the Netherlands through Buurtzorg and other organizations that have learned from its experience, sometimes with Buurtzorg support. And for example, amongst many other indications of success, the most recent inspection report from the equivalent of the Care Quality Commission gave Buurtzorg maximum scores in every department. And as I said, we start from that because if you want to provide care in that way, to enable people to do what is needed when it's needed, you don't also need to tell people what to do. You need to recruit the right people with the right training and support them to do their best, and to support each other and challenge each other as necessary in self-organized teams. And that's the way Buurtzorg operates at neighborhood level. The teams are composed of up to 12 nurses and nurse assistants. Jos de Blok, the founder, recently joked that the reason that there are a maximum of 12 nurses and nurse assistants in each local team is because they couldn't find any bigger tables at IKEA. That's not actually the reason. The reason is that the research and experience indicates clearly that above the number of 12, it becomes more and more difficult to coordinate self-management in a team. So one of the very few rules that Buurtzorg teams operate to is that when they grow their caseload and the size of their staffing to 12, they divide into 2 teams and negotiate between themselves their patches. These teams, although composed of professionals of different levels of qualifications and sometimes including specialists, for example, in end-of-life care or care of diabetes, or care of people with diabetes, although those levels of qualification and specialization may be reflected, for example, in levels of pay, because Buurtzorg has a collective bargaining relationship with its staff as part of the whole health and social care system in the Netherlands. Nevertheless, the teams operate in a non-hierarchical way and make decisions as equals. And amongst the decisions that they make are all the things that are best made all the decisions that are best made at team level, which includes choosing and managing their own office, determining their own education and training needs, both individually and collectively. Each team, for example, is allocated a training budget, which it spends as it chooses, which is 1/3 of the turnover of that team. And they also share and rotate a number of organizational tasks that are best done at that level. And to enable them to work well in making solution-focused decisions, we all know they make decisions by consensus, but we all know that it's very possible to go on for days trying to reach a consensus so that decisions are never made. But the solution-focused approach that Buurtzorg teams are trained in and that we support with the learning and development program that we provide in Britain to teams enables teams to operate very effectively in a solution-focused way and arrive at consensual decisions which are action-orientated, try new things out, see how they work, and tweak them. And this way of working has proved extremely popular with nurses and other care professionals in the Netherlands, and indeed has led to Buurtzorg winning, being named the best employer in the Netherlands in a survey that's done annually across all sectors of the economy 6 times now. But just because you don't need to tell professionals working in this way what to do, you don't need to command and control, doesn't mean that you don't need to support. And a key to Buurtzorg's success in the Netherlands has been not only enabling the professionals to work in this way, and to provide person-centered relationship care to the people that they support, but also to provide very effective back office supports to them that does what is needed when it's needed, just as the teams themselves do what is needed when it is needed. And that's very much one of the core principles that enables Buurtzorg to function well. The teams are supported by 20 regional coaches whose role is not to tell the teams what to do. These are not quasi-managers, but is to support the teams to make decisions for themselves when they get a bit stuck, as every team will do from time to time. The 20 team, there are now 950 Buurtzorg teams in the Netherlands and 20 regional coaches. So you can do the sums. There's about one coach for every 45 or so teams. This means that the coaches don't spend more time than is desirable with the teams, and the teams don't become dependent on them. And typically, the coaches will be spending most of their time through a year, of course, visiting each of the teams in their patch, but at any one time, spending most of their time with any teams that are getting a bit stuck. The organization has also developed in a highly iterative way a very effective IT system, which not only enables the nurses and nurse assistants to provide, to do their care assessments and evaluate the impact of the care plans, but also acts as a sort of an intranet to enable knowledge to be shared right across the organization, which has now grown not only to 950 Buurtzorg teams around the Netherlands, with around 10,000 nurses and nurse assistants, but also has led to the creation of half a dozen additional smaller organizations providing domestic help in the mental health care field, in maternity services, and in youth care, but still served by a back office of only 50 people. And that's possible not partly by outsourcing some technical functions such as payroll, but mainly by having an approach to supporting the teams that says we don't command and control, we do support and serve. And that's what Buurtzorg does very effectively. So since we started our relationship with Buurtzorg and set up Buurtzorg Britain and Ireland about 3 years ago, we have now been working all around Britain in, this is a slightly outdated indication, but roughly 25 different organizations around Britain in a variety of different ways. The first work we did was in London with Guy's and St Thomas's NHS Foundation Trust, where we supported the development of 2 teams, which have been functioning very well in Lambeth, in the London boroughs of Lambeth and Southwark. And we've also worked with, oops, sorry, my mistake. The picture in the bottom right there is of the team from East London, Tower Hamlets, that visited, that we took on a study visit and for some early training in self-management nearly 3 years ago now. The picture on the top right is an example of non-nursing organisations that we've been supporting. Some of you may have heard of the Neighbourhood Cares project of Cambridgeshire County Council, which is a very much, I think in a very interesting way, developing a new approach to neighbourhood support, deriving its influences not only from Buurtzorg, but also from, for example, asset-based community development, which is associated with Cormac Russell. And that picture shows one of the initiatives they took. And if you want to find out more about it, that's a tuk-tuk that they bought to be part of their community resource. And at the end of this presentation, you'll see an email address for me, and any details you want about some of those projects and contacts you might want about these examples, just give me a shout and I'll send it to you. We've also been, so some of the teams that some of the organisations and teams we've been supporting have been newly formed teams of nurses and nurse assistants providing holistic care, just as Buurtzorg does in the Netherlands. But some have been nurse teams that are not providing personal care as well as clinical care. Some have been home care teams that are providing only social care and not clinical care. Some are working in the in particular fields, such as the team that I've pictured there on the upper left is an organisation we're working with in Scotland called the Thistle Foundation, a wonderful organisation that provides care to people at home who have long-term conditions, and we're supporting them to change their organisation to operate as Buurtzorg does. And to the right there, all those hands belong to some wonderful people in Dublin who are all migrant workers who provide home care to people in Dublin and now are setting up their own social enterprise with our support to operate in the Buurtzorg way. So there's been a wide range of work that we've done. So far, all of it has been to support existing NHS, local government and social enterprise organisations to learn from the Buurtzorg experience in various ways, sometimes setting up self-managed teams, sometimes taking initiatives that have been inspired by Buurtzorg but don't involve self-management. But in all cases, trying to see how those organisations can change from within to enable their professionals to better provide person-centred, relationship-based care. And the experience we've had so far has been a very rich one. I'd sum it up like this, and this is also expressed in the growing number of independent formal evaluations that have been undertaken of the work that we've been supporting around Britain. The earliest of which was, as I mentioned, in Guy's and Tommy's. And just last month, another evaluation was published about the work that we did that we supported, I should say, in Tower Hamlets in East London. A couple of months ago, King's Fund published an evaluation of the work in West Suffolk. So there's a growing body of evaluation now to add to our own anecdotal evidence. And I would boil it down like this. The experience shows that if you give an opportunity to care professionals, and indeed I would argue in almost any sector, people who work for a living, if you give an opportunity to those people to work in a self-managed way, individually and collectively, and to do what is needed when it is needed, mobilizing their professional qualifications, their vocational commitment, and simply their intelligence as adults. Guess what? They love working that way. Who wants to be told what to do when we're all intelligent adults and can use our own judgment? I say give an opportunity to deliberately, however. There are also examples where some organizations, in their haste to gain some of the benefits that Buurtzorg has achieved, start to tell their frontline people, I hate the expression frontline, but I haven't come up with a better one, suggestions welcome, but who try to tell their professionals to be self-managed, and that's going to be a bit less successful. Creating opportunities to work in this way is the key. Secondly, the experience is when that has happened, the quality of the care and support that those professionals have been able to provide has very much improved. And again, if you look at the evaluations I've mentioned, I think the evidence for that is very strong. I was particularly pleased in the really excellent evaluation done by Barry Drennan and colleagues at Kingston and St George's, who not only interviewed and observed the practice of the neighbourhood nursing teams that are working in the Buurtzorg way, but also did similar observation and interviews with the rest of the community nursing service there. And what they found was not that what the Buurtzorg or the neighbourhood nursing teams were doing was great and what the community nursing teams were doing was not good. On the contrary, the experience was that from the patient point of view and from the staff point of view, the service that was being provided was good right across the board. But the qualitatively different experience, both of the professionals themselves and the people they were supporting, shines through in that evaluation. I really recommend that you read it, as well as the more recent evaluation from Tower Hamlets and the one from King's Fund, and one or two others that are emerging. Give me a shout and I'll send you the links. But, and this is the big but, what we've also seen equally consistently is that the barriers to growth, moving from the test and learn projects that we've been supporting to scale, are a lot to do with the challenge of organizational change. I take my hat off to Guys and Tommies, who enabled the evaluation team to conduct very frank interviews with some of the nurses that have been experimenting in this way. And some of what they said is represented there on the screen. It is a big challenge to move, it's one thing to set up a small number of self-managed teams in an organization which otherwise doesn't change. There's all sorts of things you can do to make that work. But if you want to grow to scale, actually the organization itself, as Buurtzorg showed, needs not to be a command and control organization, but a serve and support organization, and indeed may and is likely to will certainly need fewer layers in it, will certainly need a different kind of culture in it, will certainly need different mindsets in the organization, and that's a big challenge, and I don't think we should underestimate it. And so I would say, and this may seem counterintuitive, but we would say to organizations, if you're serious about this, you need to treat it not as something that you can do in a marginal way in your organization, but actually as a pretty fundamental organizational change challenge. And if you do that, there's lots of experience about how you can move from the kind of hierarchical organogram that is represented in the top right corner of your screen there, to the kind of organogram which we've represented down in the bottom half. That is possible. We've seen in the Netherlands how that is possible, not only in Buurtzorg's case, which is a startup and therefore didn't have to make that transformation, but also in the case of some organizations Buurtzorg has supported to make that transformation from that top hierarchical approach to the bottom there. But that's what, in many ways, the challenge is about, an organizational transformation, which includes actually, for example, how do you grow from early experience on a small scale to becoming the norm in an organization, a challenge that Guys and Tommies and others are confronting right now, and for that matter, the teams that we're working with in Kent. How do you do that? We're building a lot of experience about what that involves, and I think we're able now to offer a lot more experience, but also it really is about the kind of leadership commitment to change and an understanding the logic from going right back to the person-centered relationship-based care that I started this talk with, right through the same logic to self-organized teams and to the way those teams need to be supported within their own organizations. But then, of course, wider than the organization, there's a whole number of systemic challenges, which I don't think I need to go into much detail about here in this presentation, because they're only too familiar, I'm sure, to all of you who are listening. But one of them in Britain is, yes, we've been able to support a number of organizations in the NHS and in local government to do either nursing care or home care or social care at home without doing holistic care that breaks across those boundaries. But if you're going to be able to, one of the real strengths of Buurtzorg has been that it's able to reduce the number of different professionals going into someone's home, able to provide holistic support so that the same small group of professionals can provide very high level of clinical care and quite basic personal care. And that's been key to its support, to its success. So I'm not saying that it's impossible to take from Buurtzorg's example how to change the way in which service is done as they are now. I'm sure it's possible to do them better and to improve staff satisfaction by doing them more in the Buurtzorg way. But I would still emphasize that actually what Buurtzorg is about is holistic care. And that's a challenge, of course, in the structure of our system in Britain, which is reflected in part in the way in which financial flows work. Free at the point of use, obviously, in the NHS, and means tested and so on in social care. So that's another systemic challenge. Although we know for sure that by working in this way, we can make community nursing and other community services much more attractive to people to work in, more likely to want to work in them and to stay. Nevertheless, we have a recruitment and retention challenge to get started in moving in that direction in Britain. And also that's reflected perhaps in some of the, in the approach to learning and development, which of course is meaning that we're supporting workforces through learning and development to work in highly hierarchical organizations and sometimes quite siloed organizations. And perhaps that's an aspect of learning and development that needs to change. But none of those will change, of course, without widening the conversation about the kind of services, the kinds of relationships, and the kinds of organizations that we need to provide the best care that we possibly can and the best support, and to do what Buurtzorg represents, which is not only providing care at the neighbourhood level, but by mobilizing community supports more and more, by involving communities, by developing different kinds of relationships between the professionals and the people that they support and other people in the communities that they serve, to build truly communities of care. And what I think Buurtzorg really represents, in the words Buurt and Zorg, is building neighbourhoods of care. I've referred to many of the challenges that we've faced and the lessons that we've learned. Where are we going to go from here? Well, I think we've learned a lot about how we can better support public and social enterprise organizations to learn from Buurtzorg's example and change the way that they work if that's what they want to do. But many people say to us, yeah, but, and have said to us throughout the work that we've been doing the last 3 years, wouldn't it be easier if you set up your own social enterprise to provide care the Buurtzorg way? And I have to admit that strongly, though, and everything in my background and still in my sensibilities, is that we really can and must support the public sector to change. Nevertheless, I can see why people suggest to us that actually we can overcome more quickly some of the bureaucratic and systemic obstacles by setting up a social enterprise to provide care in the Buurtzorg way, or supporting social enterprises that are already setting themselves up to do so. So we're looking at that possibility very seriously. But the other thing I've learned personally, and I think we've learned a lot collectively in my team over the last few years, and with many of the organizations we're working with, goes right back to the fundamentals of what Buurtzorg's about, which is that, yeah, it operates through self-managed teams, and that's important. But actually, what it's really about is changing the way that public services operate so that they are able to connect and support and connect with and support the freely given community power, if you like, and the assets, the strengths in communities, and I've been particularly inspired in this by the work of the neighbourhood cares teams in the Netherlands, in Cambridgeshire, which led me to try to learn a bit more about it. And I'm delighted to say that the asset-based community development movement, and represented in Europe by Cormac Russell, and we are now looking at how we can collaborate more effectively to support the kinds of change in public services that we both want to see from the different points of view, from the organizational point of view in our case, and from the community point of view in theirs. And that's why, just to flag up an event we have coming up in London on the 21st of April, which we're calling Caring Places, Building Healthy Communities. If any of you have ever wondered, what would a conversation between Jos de Blok, the founder of Buurtzorg, Cormac Russell of ABCD, and Hilary Cottam, who needs no introduction, what kind of interesting things might come out of a conversation between those three? Well, come along on the 21st of April and you'll find out, amongst many other conversations that we're setting up that day. That's just a little teaser for now, and I've probably gone on a bit longer than I should have. Thank you very much for your attention.
Thank you, Brendan. That's great. Could you stop sharing your slides, and then we can see you a bit more clearly, and maybe I can ask you a few questions.
There we go.
Okay. Brilliant. Thank you. So I've themed some of the questions that came in from the registration, and also Matthew and I have been trying to spot questions as they come up in the thread. And I know you mentioned the barriers to growth in terms of Buurtzorg inspired or Buurtzorg approaches in organisations are about organisational change. There's been a suggestion that there are ways of protecting teams or protecting pilots that are useful. What would your advice be about that, Brendan?
Well, our experience has been that you need, firstly, it of course makes sense in any organizational change to start small and learn as you go. However, we resist the term pilots, not only because it's, well, for all sorts of reasons which people on the call will be familiar with, but also because we want to discourage the idea that testing and learning is about seeing if something works and then telling everybody they've got to do it if it does. Our approach is, if you look at the way Buurtzorg grew, it grew organically by the early teams. It was set up by 4 nurses who set up as one team, and now it's 950 nurses, and all of those teams have formed themselves. And so that organic growth is really important. But within existing organizations, particularly in the public sector, if you want to enable those teams to thrive to begin with, first of all, you need to set them up in a way that provides protection from the prevailing rules and procedures of the rest of the organization. Now, that doesn't mean to say that anything goes. I mentioned, or at least one of the slides mentioned in the talk, the importance of the framework within which self-managed teams work. It's a simple framework in the case of Buurtzorg, a framework of, which can be expressed in one page side of A4 about providing great care, great working lives, and doing so in ways that use resources efficiently. And those are the 3, if you like, key goals that need to be achieved. Now, setting up a framework. So when you're setting up in an existing organization, you need to, first of all, devise such a framework, a simple one, and have dialogue about it within the organization so that everybody's bought into it. But then you need to protect the team so that they're able to work to that framework. And we call that role a heat shield role, to protect the teams to work in accordance with that framework and protect them from the normal rules and procedures of the organization and grow from there. So we have found that that's very important. And if the teams are not able, the test and learn teams are not able to give expression to what they need, because what typically happens is they get working and they discover there's some procedural or systemic issues in their organisation which are either hindering them or not helping them as they need. They need to be able to give expression to that and get support through the heat shield to get the changes that are needed for the organisation. So that iterative way of working is really crucial to building up from a test and learn to scaling. And frankly, we haven't yet had enough experience to show how that can be done successfully to scale. But for the test and learn teams, it's fundamental to protect them with that heat shield role.
Thanks, Brendan. There were some threads, some questions as people registered, and also a request, and maybe we can put some links to evaluations, independent evaluations, in the follow-up email that we send. But I wonder if you could talk a little bit more about the evidence of impact. And also there's been some questions around the impact of working in this way on staff, on the people that are working in services. I wonder if you could maybe share some examples or stories about that.
Well, one of my favourite stories actually, and it comes out of one of the Guys and Tommy's teams, but there are similar stories in all of them. But one of the Guys and Tommy's teams early on, their referrals initially came from GPs and so on, but then the rest of the community nursing service started to make some referrals to the neighbourhood nursing team too. And there's a particularly illuminating story, I think, of one client, Buurtzorg tends to call the people that they support clients, of one person who was receiving who had very bad leg ulcers and was receiving support from the community nursing service in the form of changing dressings on those leg ulcers and looking after those leg ulcers very efficiently and very well. But what the neighbourhood nursing team was able to do was devote a bit more time up front than the community nurses had, with their too many people to visit in one day. And you know, the number of people that they were needing to visit, making it very difficult to do more than the task that is presented. And what the neighbourhood nursing team was able to do was spend some time getting to know that person, and the result was eventually that they were able to encourage that person and support that person to get out more. I mean, I'm not going to go into the detail. I think the detail is given in the evaluation, but essentially by building the relationship, by getting to know the person, by finding what made her tick and forming that relationship, it was possible to take some steps which enabled those leg ulcers not only to be treated well, but actually to recover quite rapidly. Now, the consequence of that for the person receiving the support was obviously fantastic, because these very painful leg ulcers were dealt with. Fantastic for the nurse, because this is why the nurse came into nursing, not to patch somebody up, but to enable somebody to recover and live the best life possible. But also good for the system, because of course this was somebody who then could be discharged after a few months, so those financial savings come in. And when you look, for example, if you look at the Tower Hamlets evaluation, one of the things that shines through from that is that if you extrapolate from the kinds of changes that the team there was able to make, you're able to, you can see how both at an organizational level and a systemic level, savings would arrive from fewer referrals to A&E, from fewer GP visits, and other sources of savings in the system. So there's lots of different examples of that. And I mean, we can put anybody in touch with a number of the organizations and individuals around the country that we've been working with. The stories are best told by them, because, you know, I'm telling you secondhand, but they can tell you firsthand, and with much more authority.
Thank you, Brendan. And I think we can share your contact details, can't we? I think they were on your slides, but we can.
Yeah, no problem at all. And we can also, I can give you all the links to the evaluations that I've mentioned.
So my next question is around the relationship building focus, which obviously Buurtzorg has, and that's been a focus of the ABCD approach as well. I've also heard it said that relationship building is something that is sadly neglected in the NHS and in wider social care. Have you any advice or tips to offer in terms of how anybody can improve their focus in that arena?
Well, it's true what you say, but one of the things that inspired me in this work was, as I mentioned at the beginning, I was my mum's principal carer towards the end of her life, and that meant getting to know some of the home care workers that supported her. And what I learned was not that they were unable to make the kinds of relationships that you would want because of their personal qualities, but they were thwarted by the time and task approach to care, having to dive into someone's home, do certain things and get out again. They were thwarted by doing that. But what was remarkable was the way in which they did their very best, nevertheless, to form those relationships. At least some of them did so. And I think, I mean, one of the light bulb moments I had when I used to talk to my mum's carers was there always used to be some problems with, you know, sometimes the care worker wouldn't show up, or my mum would have a situation where I needed to cancel a visit or whatever. And I could never get through to the office. And I said to one of the care workers, oh, it's so frustrating. I called your office and nobody ever answers. Surely there's a secret number you can give me. And they said, no, we use the same number and nobody ever answers our calls either. So I said, well, what do you do when you've got a problem? And they said, we call each other. And it was a light bulb moment, because I thought, actually, what's happening here is this is a resilient workforce that is doing its very best. And we're not even talking about nurses here, but I think even more so with nurses. There's a workforce that does solve problems, that does form the kinds of relationships that are needed, not only with the people that they care for, but also with each other, despite the organizational and systemic obstacles in their way. And all we're saying is not that they don't do that, but that how much better it would be for them and for the people that they're supporting if this was encouraged and supported by their organizations and systems rather than thwarted by them. So I think the personal qualities and, you know, the well-trained people and well-selected people with the right values, I don't think they need to learn from us very much about how to make those kinds of relationships. What we need to do is remove the obstacles in their way of doing so.
So that links to another question that's coming up in the group chat. So if we improve, if we employ these types of approaches as Buurtzorg does, and we have an impact on staff in terms of their happiness, their well-being, what sort of impact does that have on recruitment and retention, Brendan? How is that playing out for you?
Well, it's too early to say in Britain, unfortunately. I mean, I remember when we were first working in London, the organisations we were working with said, well, we can't just recruit to these new teams internally because everybody will want to join them and it will deplete our other teams. So they opened up recruitment more widely than that. So there was obviously some intuition there, I think correct intuition too, that that many professionals will want to work in this way and will jump at it. And certainly, I mean, you know, I've now worked with literally hundreds of nurses and other care workers around Britain in this context. And the thing that moves me day after day, and really moves me, is to see their joy at work and to see how satisfying it is for them to be able to work in this way. And the brilliance of the work that they do as a consequence. I mean, I'm just completely humbled by it every time I spend time out with these amazing people. And in the Netherlands, there's very strong evidence. Buurtzorg grew from its one team in 2007 to 950 teams today. Organically, but in two ways initially. By first recruiting, attracting back into the profession to work for Buurtzorg nurses who had left the profession because they were fed up with the way in which they were being asked to work, and also to recruiting from other organizations that were not working in the Buurtzorg way. So at one point, Buurtzorg was recruiting 150 a month, which was an incredible rate of growth. It's slowed down now. And the reason it's slowed down now is that even Buurtzorg teams are struggling to get to recruit. And that's because the supply is not coming through quickly enough, both through the, people are not putting themselves forward to be nurses enough. And there is still a tendency to see community services as something you do later in your career rather than when you first qualify. So I think we've got some systemic issues around recruitment and retention and what we expect of nurses and other care professionals to do, not just at an organisational level. But I think to the extent that we have evidence in Britain and certainly internationally, and especially in the Netherlands, the evidence is pretty strong that if you, and it's commonsensical too, really, isn't it? That if you create conditions in which people can bring their whole self to work and really give expression to their professional training and their vocational commitment, well, what do you know? They're going to want to do it, aren't they?
Thank you. So there was a question that came up through the registration.
I just add one rider to that.
Sorry.
Provided that they get the support that they need, rather than being made even more vulnerable by working with greater levels of responsibility and taking on more risk within organizations and systems, which will then come down on them like a ton of bricks if something goes wrong. That's really important, rider, to what I said before. And I know, for example, the work that we've been doing in the children's social work field, where we've been working with the Centre for Public Impact and Frontline and developed this so-called blueprint, which Katie Rose is going to be talking about in the second of this series. That's a really important factor for social workers. Why would a social worker, or for that matter a nurse, want to work in an environment of self-management, individually and collectively, if that's going to expose them to even more risk of being blamed of not being supported rather than anything else, and particularly of being bullied or whatever else goes on in many organizations now. So that's a really important rider. I don't think and I'll be honest about this, I think we've made a lot of progress over the last 3 years, but it's not surprising, I think, that in the public sector, it's not surprising, it's not accidental in the public sector that we haven't yet got to the scale that comes with this way of working being the norm in any particular community nursing environment. And I think that's because of the organizational challenges. And a lot of that's to do with are we willing to shift from command and control to support and serve and everything that involves?
So that links to another theme of questions, really, which are around governance challenges, Brendan, and that probably speaks to that kind of illusion of control, new public management aspect of some of the cultures that are still around. I just wondered if you wanted to, or if you could say anything more about that, particularly in relation to governance, I think.
Well, firstly, I'm an optimist. Even after December the 12th, I'm an optimist. And indeed, I think there may well be opportunities arising now to do things in a very different way. And more, we all see around the country, there are brave, very pioneering, brave leaders, the kinds of work that's been done in local government, in Wigan, in Preston and other places, the kind of work that is being done in the NHS by an increasing number of organisations, not only working in the Buurtzorg way, but working in other ways to provide more person-centred and relationship-based care. I do believe and of course the Q community and you in the special interest group have done a lot to contribute to this. I really believe there is a strong movement growing that has tremendous potential. And I think to realise that potential, I'm particularly interested in the discussions that are taking place about how local government can operate differently, the kinds of work that is being done by the new local government network, for example, the discussions that you're stimulating in the special interest group. I think more and more, the more we can get organizational leaders and practitioners talking about this and talking about the kinds of relationships they want to have with the communities and with the individuals in their communities that they particularly serve, patients, in other words, in the NHS case. The more we can encourage that, I think the more we'll be able to change the culture and contribute to cultural change in these organizations. So I think there's no shortcut to it, really. I think we've got to keep doing what we're doing, learn as we go, share the learning as we go. And Buurtzorg started with one team in 2007. It's now not only a large organization itself, but has really had a big impact on the system in the Netherlands. Well, I think we can do the same over the next 10 years. And to be honest, I think we will.
Thank you, Brendan. So I'm just aware of the time. I'm aware that there might be some questions that we haven't covered, or there might be some questions that are going to come up for people as they review what they've heard on this webinar. If you want to join the SIG group, you are very, very welcome, and we can continue our discussions in that space there. That'd be great. So I want to say thank you very much to Matthew Mezzi for supporting our webinar. I want to say thank you so much to Brendan for giving us your time and your continued support for the special interest group, and thank you for everybody for attending. I think Matthew's been posting the link to the next webinar with Katie Rose, again talking about these approaches in children's services. Brendan, just remind us again, you said you're in London in April with this new event. Yes,
April the 21st. You can, at the last slide in my presentation, you'll see a link that you can go and register your interest. Tickets will be, unfortunately, on sale rather than freely available. But I think it will be a very exciting event, and more details will be following over the next few days. But please hold the date for now. 21st of April, that's the day before Annie's third in the series of these. So thank goodness we're not clashing with that. 21st of April in central London, more details to follow. Please put it in your diary. Okay, so we will circulate those slides. So thank you very much. Have I missed anything, Matthew?
Don't think so. We'll be sending a follow-up email, so there'll be various links and things in that, and we'll be sharing the slides and so on.
Okay, thank you everybody, and I hope to see you again in February.
Thank you everyone, it's been great, and please do get in touch. We're very happy to hear from everybody.